All right, speaking of those warmer conditions, are you heading down south for the winter? Your pharmacist is ready to help you stay healthy for the winter season. Here with more, we have Phil the Pharmacist from Hauser's Healthcare. Thanks for joining us, Phil.
Oh, thank you for having me. Especially when we're talking about Christmas trees and Christmas movies. For some of us, when the weather turns, we're thinking sunshine. So
I am so jealous of those people, and you look like you're ready to be in the sunshine as well.
I would love to be in sunshine right now.
All right, what do snowbirds need to know before they go?
So one thing that we tackle from pharmacy perspective is certainly that as people are going down south, they want to make sure that the medications are lined up and that they've got enough to be able to go down for, you know, the couple of months that they go down all the way up to 6 months. And now for the majority of people that are snowbirds that are seniors, they're covered by the government drug plan, and that allows them to get a 6-month supply. Okay. But that 6-month supply, and here's where the trick comes in, as you can see from the graphic, really depends on how much medication they have left. And this is where your pharmacist becomes really valuable, because there's a little bit of math here. And I know it's 7 o'clock in the morning on a Thursday, but we're gonna try this here. So in our first scenario, we've got a prescription that has 45 days left. So you got just over a month's supply. And if you're gonna leave on November 1st, we can get you 2 100-day supply, and both of those are gonna be covered under provincial drug plan if you're a senior. On our second scenario there, let's say you've only got 3 or 4 days left. So you haven't told your pharmacy that you're leaving, but you've got a few days left and you want to get away on November 1st. We're going to give you a smaller supply, a 30-day supply, so that we can get those 2 100-day supplies there and get you through your whole time there. Now, in our third scenario, we've got 90 days left. So you've just gotten this 100-day medication filled. You're not going to be able to probably get both of those vacation supplies covered. So we're going to do the one that we can do, but there is one that you may have to pay for. And that's where doing a little bit of pre-planning, and that's the reason I'm on here today, doing this little bit of pre-planning could actually prevent you from paying a lot of extra money. And when we talk about cost differences for a lot of these medications, I look at something like Ozempic, where the cost down in the United States can be up to 5 times or more than it is up here. So it pays to do that little bit of pre-planning before. And of course, as you're down there, there's lots going on. We're looking forward to the pickleball, and everything that we get to experience down there. But that doesn't mean that things don't change. Yeah. And of course, when things change, what does that mean? There are insurance considerations that have to be taken into account, but there's also an opportunity there to still interact with us as a pharmacy. And we do ship medications down to the United States from valid Canadian prescriptions. We can't fill American prescriptions, and American prescriptions can't be translated back to Canada. Okay. But if you're down south and something happens and you have a change in medication, certainly contact your pharmacy, see if there's something we can do. A change in health is one of those things that happens not only to people going down south, but it can happen to people up here as well.
I actually offer service for that as well. Just about 30 seconds left.
Oh, sure, yeah. So one of the other things that we offer at Hauser's is PSW and companion care services. So if you're taking care of mom, if you're taking care of a loved one that has a chronic condition, we offer, we can get somebody in there to do their cleaning, to help with their medications, to be with them 24/7 if that's what's required. We have low minimum hours to make sure that everybody is taken care of well. But the important thing is that you know that your loved ones are taken care of when they work with Hauser's.
Amazing. That's actually all the time that we have. Where can we find your info?
At hausershealthcare.com, or you can visit one of our many locations. We actually just opened up our new Niagara Falls location yesterday, and we have a new one coming in Simcoe, hopefully by mid-November.
Amazing. Well, congratulations on the new locations. Thank you so much for your time today. We'll get all your info up on our website. That's
Thanks
all
a lot,
we have today.
Cheers.